Meantime, a local mother fighting to overcome cancer. A Germantown woman diagnosed with 2 different cancers, one so rare only 500 to 1,000 people in the U.S. are diagnosed each year.
New at 10, Shannon Sims tells us about the new procedure that could lead to early detection for other members of her family. Shannon.
That's right, Carol and George. Doctors are now looking beyond radiation and chemo for sarcoma treatment. Genetic testing could be key in prevention. Heidi Sprang is under 40 and finds herself in a fight for her life.
This totally turned everything upside down for us, completely.
The this Heidi is referring to is a lump she noticed on her shoulder one day getting out of the shower.
Never seen it there before and became really concerned and went literally that day to a walk-in clinic.
After tests, x-rays, and a biopsy,
I literally thought I was just going in to get something benign removed. And a couple weeks later, getting that phone call that it's in fact cancer.
Heidi was diagnosed with pleomorphic liposarcoma.
It's very rare compared to breast cancer and lung cancer and prostate cancer, things you hear more about.
Nick Weber with Aurora Cancer Care is Heidi's doctor.
Hi, Heidi. How are you doing?
Doing all right. How about you?
Good. Nice to see you.
Dr. Weber is nationally known for his work with sarcoma patients.
To treat sarcomas. In the past, we've been doing chemotherapy and radiation, but now we're seeing if we can really plug into that genetic code to change things.
A change this family desperately needs. Not only is Heidi fighting sarcoma, she was also recently diagnosed with thyroid cancer and had her thyroid removed. Her father, 15 years ago, faced prostate cancer. Her sister has battled breast cancer, and it doesn't stop there. 4 years ago, Heidi caught a rare cancerous tumor growing in her daughter's right eye.
And the other component is that we're all very young when we were diagnosed with cancer.
Dr. Weber says genetic testing could be key for early detection in Heidi's children or anyone with a family history of cancer, especially sarcomas.
In the case where there is a genetic predisposition, there are things that we can do. We look for genes called tumor suppressor genes.
The lack of one tumor suppressor means a person's capacity to fight off cancer is cut in half. Early detection can save lives. Through it all, Heidi has found strength in her husband and her children.
We're a family together no matter what, and we'll make it through. We made it through with Natalie. We'll make it through this too. Let's go.
Together with her team of doctors, the family is determined to beat cancer.
Absolutely, hands down. If we didn't have God in our lives, I would feel like this would be hopeless.
Well, last Tuesday, Heidi had that mass removed from her shoulder, and she's now at home recovering.
Well, that's good to know. Shannon, 2 questions.
Okay.
Who would doctors recommend for genetic testing, and is this covered by insurance?
So the genetic testing is normally done for those with sarcomas. However, when you ask about how is it covered, insurance will cover it if it's recommended as a standard care by the doctor. Clinical trials also something that are financially supported by research hospitals or drug manufacturers. So there is hope in new techniques.
Well, that's good to know, and she's going to be okay.
She's going to be all right.
We like to hear that. Thank
Yes.
you, Shannon.